can go. So, so this is the program I was talking about. As in the first slide, I was showing that we work for creating systems, and so we try to get programs, policies, schemes from the government, but we also demonstrate it on the ground that how easily people can uptake the scheme. So this is one we are demonstrating for health, education, and social security in one district in India, and it is being very popular. So we have this information center in the village, so people can go and seek information about these schemes, and then you can look at, we get the government people to that information center, and the government people talk to them, talk to the villagers about the schemes, and then we organize camps through the government so that the people can be directly enrolled in the social security schemes, and then to increase awareness among the children. So we organize rallies, and then about sanitation and hygiene in the school. And then we are creating in every area citizen leaders. So, and also training them. So we are developing a cadre of citizen leaders in the entire district, and these citizen leaders will take on the program after we withdraw. So basically these are despite the health programs and despite for the budgetary allocation for health, the people were not coming for to take this program up. So we organized various methods, and we provided government with certain tools like they have these outreach workers. Now the outreach workers have tablets, and in the tablets basic checkups can be done, and it goes to the central server from which it is monitored. So now that encouraged people to come to the health centers. So now people come to the health centers, and it's called Health Cube. So it's a new instrument which a company had developed, and we took it to the villages, and now the government has bought all that and given to their outreach workers. So we demonstrated in few villages, and then the government realized that if these health cubes are there, then it is easier for villagers to access health. So these are the like events which we are doing in the districts. And if you look at the newspaper cuttings, so lot of lot of articles written about that interventions which we did. So the idea is that we should not only talk about big programs, we should not only talk about big laws and big policies, we also demonstrate it on the ground that this can happen through this method. And those examples become part of the policy so that they're easily done. And also we try to follow both the way. So bottoms up also we try to follow, and top down also, so that there is, in a country like India, we need both top down and bottom up approach, so that the perfect marriage is there. Otherwise, many times good programs are made, good policies are made, and they are not implemented. I just put this slide because one of our major focus is to raise the issue of informal workers at various forums. So like this forum, I've been invited. So we get invited whenever we get the forum, we try to put the issues of informal workers. So today, if you ask people in India, there's a lot of awareness. They know that the unorganized worker need help, they need program, they need laws, they need the social economy has to be strengthened. for these workers. Earlier, there was no sensitization or no awareness about this informal worker. So these are just like big events where we raise the issues of the informal workers. And in this process, we develop materials, innovative materials for the unorganized workers. Even we make use of famous music directors to create songs for informal workers. So we created one song for street vendors, and it was it is very popular. We also created one on social security for informal workers, and we used very famous singer to sing for that song, and that song is also quite popular. So and also we are now using lot of technique in on mobile technology, so so that the unorganized workers are educated, their leadership is developed, and they get to know what they need to do in terms of solving their problem. So as in the first slide you saw that system approach was very important for us and is very important for us to bring change among the informal workers. So now I'll give you so we got for the street vendors, we got a policy, and then we got a law for the street vendors, and then for for construction workers, there are welfare boards now set up in India. So the construction workers, so if you are constructing a house, or if government if any big company is making a building, then a certain amount has to go for the welfare of the construction workers. And from that fund, the construction workers get benefit like health, illness, sickness, and for buying equipments, for education of the children, for pension. So in India now, almost all states have the Construction Workers Welfare Board, and that Construction Workers Welfare Board takes care of the welfare of the construction workers. So we are trying to get more of such boards. Some of the states now have this the state welfare boards, like Tamil Nadu in southern states. We are advocating for boards in other parts. Some of very innovative boards, like for manual workers, have been set up. So we do campaigns so that the policy makers and they know about these kind of boards, and they know what good practices exist in the boards. So, and one of the demands which we have now begun raising is that because in 2019 India will have general elections, that the political parties promised to set up a department for unorganized workers. Why? Because 93% of the population of the workforce is in the unorganized, and they need special attention, so that because the future of the country lies in the better welfare and in the better inclusion of these kind of workers. So along with that, we do advocate for slum policies. So now India has a slum policy. Earlier, the slum dwellers were evicted and sent to far-off areas, and in the far-off areas there is no work, and so their condition became very bad. Now we have a policy whereby you have to settle them within 5 kilometers from where you, either in situ or either in the same area you make multi-storied, or you make alternative housing, or within 5 kilometers of the area of residence you have to settle them. You just cannot throw them away in far-flung areas where there is no work. And similarly, there was in the previous government, there was a very good health insurance scheme. We began piloting health insurance in one state, and the government was very impressed with that. So along with other organizations, we advocated for health insurance, and that program became a very, very successful program of the previous government. But this government has amended it, saying that they will bring a new program, but till now they have not brought any new program. So similarly, we are advocating for policy for domestic workers, policies for home-based workers. So we got for the West because a very progressive policy 2 years back for solid waste management, which calls for management of waste through involvement of the waste pickers. If you ever happen to see a waste picker in India, it is beyond one's imagination the way they segregate the waste. You know that when they have the waste, they will segregate. They know with how much thickness which plastic will sell for how much. So even best of the machines cannot segregate, cannot find out the wealth from that waste. But in India till now, we have not been able to integrate it, make use of that skill in the management of the waste. We somehow try to take the West model to India, and still Indian cities are very dirty because of that. So instead of realizing the internal qualities of people there, we feel that taking the Western model of waste management will be of help. And that's why, despite slogans, Indian cities remain to be very dirty. So we focus a lot on advocacy. I began with how we implement the programs. So we try to manage both the things. This is just one photograph of the demonstration. So like any other union, we do a lot of demonstration, but more than that, we try to engage with government because engaging is the key. And so a lot of focus on sharing best practices with government, giving them policy clues, making the opposition raise questions. So that kind of work. So this is one example of the work with the street vendors. We began a network called the National Association of Street Vendors of India, and 98. Then we registered it as a separate organization in 2003, and in 2004 we got a policy for street vendors, and in 2014 we got a law for street vendors. Now that law is a very empowering law, and now we are engaging with government for implementation of the law, and we have demonstrated in some cities in India that if this law is implemented, then the chaos in the cities can be very well managed, and the street vendors will be able to sell with dignity in the vending zones that have been created. And so there is no, so in those cities there is no harassment. The vendors sell with dignity, and people also know which are the vending zones, and the local government also gets a good revenue from the vendors. And so that the Street Vending Act which we got, and I mean in terms of number, India is mind-boggling. Like vendors also, we have 20 million vendors. So it's not a small population. And those cities which are not following the law, we are going to the court and making court pursue the